telehealth does not equal digital health.
It's 62 clicks to order a Tylenol for a doctor, which is obscene. Welcome to Wharton Tech Talks, everybody. I'm your host, Ibrahim Bengali. We've got our wonderful co-hosts, Sophie and Chris. Say hello.
Hey, everyone.
We are, as always, incredibly excited today, but I'm even more excited today because our guest is someone who I have worked with in the past in a work setting, and I know that she's an absolute legend, and she is incredibly knowledgeable about healthcare and the future of the healthcare industry and is a really strategic thinker there. She spent the last 17 or so years at Oliver Wyman, and then after that, she went to Blue Cross Blue Shield of Massachusetts and is their chief strategy officer. And I think one thing I really want to highlight about Sukanya Soderland, not only is she inspiring in the boardroom and a force to be reckoned with, but she's also the 2016 Working Mother of the Year, which I think is really important and a really important perspective that she brings to these conversations as we move into tech. So Sukanya, with that big old intro, welcome.
Thank you. This is so exciting for me to be able to see you on screen and be together with you and sort of rekindle what had been a great working relationship in the past. So very excited to chat.
Thank you for joining us, Sue. And speaking of that working relationship, I think in the couple years since, maybe I've evolved, and probably not in the best way. I think after our time at Oliver Wyman and going through the healthcare management program and speaking with David Kurwar last week, I think I've gotten unfortunately jaded when it comes to the healthcare industry. And I feel like it is a collection sometimes of just market failure and a haven for middlemen to just take advantage of the system and put Band-Aids on it. And I realize that that's probably not the right perspective for someone to have, if they want a future career in healthcare. So you have always been kind of the shining pillar of optimism and of future thinking. What does healthcare look like to you going forward? Is it possible to change? And what is the ideal future that you have in your mind that's actually achievable for us?
Well, Ibrahim, I've got to say there are times and days when I too sort of sit there and wonder and say, gosh, 10 years ago, 15 years ago, we were saying, if only we could do the following, and we kept thinking it was going to happen. And I think what we all recognize is healthcare moves slowly.
So slowly.
Really, really slowly. And that can be frustrating at times. But I still, as you referenced, harbor a lot of hope. And I do view even what we've been experiencing over the last year plus with COVID as one of the exogenous factors that's an accelerant to bringing us to the future that we all want and deserve for people with respect to better healthcare. And so what does that look like? In my worldview, what I would love is for people to be able to access the right care, right place, right time, right way, right price. And that's sort of a slogan that folks have used for years. But as you start to uncover what the new technologies that we have now are able to do, it becomes more of a possibility and a very real possibility. We can talk about that, right? So, for example, in this past year, we've seen the rates of telehealth skyrocket, right? So telehealth's been around for a long time. Hardly anybody ever used it. The overall usage rates were in the low single digits at best. At our peak last year in June, I think Blue Cross Massachusetts had 70% of its health visits be telehealth related. Okay. And we're paying for it at parity with in-person visits per the governor's orders, and we had agreed to do that even prior to the governor's orders. That all being said, it has spurred a shift in what people recognize as now possible in terms of receiving care. And so if you think about how healthcare has worked in the past, it's been really asset intensive, got to go to the doctor's office, got to go to the hospital. It's been hyper local, and it's been very physician centric. And now with new technology and advanced computing, there's the opportunity, and now I think a growing awareness and receptivity from people, from consumers or members, whichever term you want to use, to say, oh, in not all cases does it need to be going into the hospital or to the provider's office. It could be in my home or on the go. In not all cases does it have to be local. I might be able to see someone who's on the other side of the country. And, it doesn't necessarily have to be physician-centric. There's a broader care team of individuals who can be appropriate at different times. And then when I've got, remote technologies available that can actually allow me to scan, our iPhones alone right now capture more information on us. It is staggering, right? Capturing your breathing, right? So we now are carrying around these massive devices that have incredible computing power that can tell us a lot. Now, does that mean it's going to obviate in-person care? No. There's a very important place for in-person longitudinal care and sick care, absolutely. But is there an opportunity to start to say, I could use certain devices to predict and prevent acute events before they happen? And I could capture this myriad of data on people to understand their motivational behavioral preferences and profiles and interact with them in the right time, right place, right way. Because I know 70% of the cost dollar is associated with what you eat and how much you sleep and whether you exercise and your mental makeup, right?
Right.
Then I could actually start to get into health care of healthy living, not just sick care. And so that's my aspiration. That's my goal. And I think we've got some of the building blocks, a movement towards value-based care, increased openness to telehealth, interoperability, cutting through the data silos and so forth that will eventually help us get there.
Is the perspective change enough? Right? Because a lot of the technologies that you mentioned, I agree, they're very promising, but they've been here for 3 or 4 or 5 years, right? Like the iPhone tracking things. And I mean, now we have the new Alexa thing that tracks your tone of voice and the emotion behind it. But we've had a lot of these things. We've had cloud and big data for a few years now. And there's an absolute plethora of digital health companies and an insane amount of money going into these companies, but none of them have scaled. So is the perspective change enough? Or are there other roadblocks that are going to still prohibit us from making that rapid shift?
It's a great question. There's no question in my mind that we still are experiencing a big chasm between what can be and what we're seeing evidenced, albeit in smaller startups, in terms of possibilities, and where the rest of the market is, where the incumbents are. And so to your point, we haven't scaled all these things. They are around. In theory, they work, but they're not actually meeting the needs of the masses. And so it begs the question of what is it going to take to actually scale it? You know, I think there are a few potential avenues that could help spur the shift. One is to the extent that there's major regulatory and policy shifts that can obviously make a difference. And we've seen in the past that sometimes Medicare and CMMI make certain changes that really start to spur the industry. And sometimes it then flows downstream to commercial. So case in point is when Medicare started covering supplemental benefits, right? All of a sudden now people are thinking about transportation to the doctor's office and healthy meals and so forth. So that's one factor.
Right.
Another factor is when you've got really progressive employers that look at the healthcare cost dollars and they say, no mas. And then they start to sort of try to determine how they on their own can take greater control of healthcare costs, and they start getting more inventive. And, you know, Walmart's probably the best example of that in terms of what they did even 15, 20 years ago, getting really smart even in terms of directing people to the individual clinicians who are best in class and best value for specific areas in medical tourism and such. So that's another example. A third factor I'd say is the rise of big tech coming into this space. Think about, you guys I'm sure saw the articles on Amazon Care over the holidays and how the announcement relative to what Amazon Care might do started to cause some managed care stocks to go down that day. And if you think about the way big tech works, I mean, they are behemoths that really know what they're doing, and in many ways. And they can, and people will say, yeah, but they tried that, didn't work before. And there are plenty of examples littered in the past of things that didn't work before. But if they can pull it off, I mean, they don't mess around. You think about Amazon. Years ago, I still remember when I first learned naively that, you know, they had ocean liners. And I was like, oh, they're actually really in the logistics business, right? And of course, now we're like, well, of course they are. But you look at Facebook and Google, YouTube, in some ways, they've got more telco infrastructure than Verizon does. And so they've got more boxes and cables than, you know, AT&T. And so if there are others that are going to make those changes, then that's going to spur the industry. And then finally, I think you've got a lot of incumbent players. Think of United Healthcare with Optum and others who I think are trying to think inventively. They still need to maintain the status quo, but they're trying to think inventively about how they reinvent the model. And their investment into adjacent services, businesses can help support that.
You mentioned, you know, well, a lot of really interesting things, but for our audience, the big tech is going to perk a lot of ears, and we're going to want to hear a little bit about that. I mean, you mentioned a few examples, and I think I would like to think that there's relative agreement that the potential is there, for Google Health or Verily or Amazon Care to make these big moves. Has anyone shown promise in your opinion?
Well, I'm intrigued to see how Amazon Care unfolds further. As we all know, they have been, in essence, piloting their new model with their employee base in the state of Washington.
Mm-hmm.
And, I think it says a lot when a company is able to really deploy the innovations that they seek to sell to others internally with their own population.
Mm.
And my understanding is that the way Amazon works, as I would expect in many respects, is that just because Amazon Care is working on it does not mean Amazon Benefits is just going to say, sure, we'll take it. They really have to sell it.
Right.
And so that to me is intriguing and I think one to watch.
As we think about that, I think there's a debate about like healthcare knowledge versus tech knowledge, right? And I think as you think about big tech trying to make the move into healthcare, I find myself in a lot of these debates where it's like, oh, you don't understand healthcare. And a lot of our, clients would say that. And thus you're not able to make a move. And then the problem is you have a lot of healthcare experts in over indexing on legacy things that are too broken. So do you have any thoughts on like, how do you bridge that gap? Or is there a right approach do you have to be healthcare first?
Great question. Yes, and we see that play out, right? When it's all the big tech or any outside industry, retail, you name it, it's sort of like, well, you don't understand healthcare is so complicated. And it's hyper-local, and it's highly regulated, and so it's like, don't even bother. And then, on the other hand, if it's just healthcare folks, at times, it can get a little myopic, and a bit of the jaded, been there, done that hasn't worked. We run the risk of not having the mental library of
Right.
case study examples of how other industries have shifted and how digital disruption and other such forces have manifested. So I think it's a hybrid approach, really, that would be ideal, is having both healthcare and outside of healthcare expertise to the table. And, I look at, the likes of an Oscar Health in some respects as really intriguing in that way. Much of their management team, I think, historically has been from outside of healthcare, but they've gotten smarter on it. And then they've also brought in, I think, some folks from healthcare and are steadily building up their healthcare related expertise and care team. So I think those kinds of hybrid mixes can make a difference. The other piece that I will say is, I think for incumbents that look to do things of this sort, I'm intrigued by the likes of what Humana is doing with what they've now termed Author, right? So this is an edge business that they created without sort of the same expectations and the challenges that are placed on businesses in the core.
Mm-hmm.
And so I think that's another interesting model to watch.
And then you mentioned regulatory change and policy. And I think in the current, right now, we're in the fee-for-service world where it's a volume game. Every knee surgery that happens, I as a provider make money, and so and so on it goes. And that's a misaligned incentive. And a lot of the policy, but also just pure business models, are in this drive to value-based care, which we've been talking about for decades. And we can debate till the cows come home whether that's really going to transform the world or not, and when that's going to happen. But my question to you is are these new digital health initiatives purely dependent on a value-based care world? Are we waiting for that to be the foundation, or can they exist in fee-for-service and help us bridge the gap until we get there?
Well, I will say that I do have a strong bias towards value-based care, as you might expect. And my employer, Blue Cross in Massachusetts, is really the one that pioneered the first ever value-based contracting model here in Massachusetts that the country has adopted to varying degrees.
Mm-hmm.
And so I do believe that is our path and our foundation moving forward. But to your point, even to this day, we still have large tracts of the country that are primarily operating on a fee-for-service chassis. And that can be really challenging to marry with some of these innovations, to your point. I think that many of the innovations work best in a value-based care model for obvious reasons.
Mm-hmm.
But I do think in select cases, it is possible to combine them with a fee-for-service model. I think the digital health innovators have to be clever and thoughtful about what their payment model is. Mm-hmm. So if they're just charging on a fee-for-service basis, that's one thing, if it's a PM. But if they're able to charge differentially in terms of value-based outcomes, that really helps. So that works best when the provider is also on a value-based contract kind of model, for obvious reasons. But I do think that there are ways to get creative. The other piece I will say is one of the challenges that we face in some ways in healthcare is an embarrassment of riches. There are so many interesting innovations out there from a provider standpoint, from a payer standpoint, from a consumer standpoint. It's almost a little overwhelming. And the way the venture capital market has largely worked, I think, has been to really reward those players that are able to demonstrate success in a narrow space, right? Show me the proof points, right? Demonstrate the value. Great. But then what you have is this plethora of sometimes super specialized startups of point solutions. This is to help your left pinky on your toe, right, on your foot. So it's sort of that level of specialization. So then when you look at it from a payer standpoint, from a provider standpoint, let alone, let's not even get to the consumer standpoint yet, it can become overwhelming. It's like there's just so much stuff. And providers alone are kind of overwhelmed with their day-to-day world and activities. You got to break through that clutter and the administrative burden and the burnout, and ditto on the payer side.
I mean, that is so interesting to me because we just had this whole EHR push, right, after the HITECH Act, and it's been billions of dollars in this industry. CTOs have led this transformation, driven adoption. You got to imagine, and I know from conversations that folks are exhausted. There is this CTO burnout across healthcare. To your point about this federation of digital health initiatives and technology and things like that, being in the industry, how do you see people managing that? Are they getting over that? Are they still stuck in that? Are there ways that we can help them through that?
Yeah, it really has been, I think, an exhausting period, especially for the CTOs of providers. And in some ways, they exhausted their financial capital on EHRs. They've exhausted their emotional and political capital trying to get everybody on board. And then, as we know, many of them are fairly clunky solutions. And up until recently have been pretty tricky to operate. My husband's a physician, and years ago, one of the neighbors came over and was asking our daughter, "So what do you do all day?" And he was sort of being a little cheeky, and he sort of said, "I click all day. I just do that." And he sort of showed that the hand movement, right, of him clicking on his mouse all day. She was like, "What?" And she said, "I thought you were a doctor." And he was like, "Yes, I am. And I click all day." And, I think there's this emotional exhaustion and frustration from it all. And so I think that's very, very real. And the financial costs, many systems invest over $1 billion, all told, right, in EHR rollout. I think that's significant. That being said, I think that we're a little, I don't know if we're over that hump fully, but I think we're on the other end of that hump now, where people are recognizing they're almost sort of forced into it in light of COVID, that there are other applications that the EHR can help facilitate. And the trick is really, how do we, to your point of what could we do, it's how does it get embedded and integrated into the provider workflow so that it's as seamless as possible. And then with the new interoperability rules and such, how do we ultimately use FHIR standards and such so that it's a smooth transition from even one sister hospital to another sister hospital that may be on different instances of Epic, as an example. So I think we have a ways to go. I'm hoping we're on the other side of it.
Hopefully. I was reading yesterday that it's 62 clicks to order a Tylenol for a doctor, which is obscene. And that's an average number, not even, a one-time outlier. But as much as we are sick of, are tired of, are exhausted by EHRs, they provide this really interesting idea of what we can do with data, right? And there's many, many, many things and many, many articles talking about how we need to improve our EHRs to this whole new health IT infrastructure. But maybe taking a higher level than that question, I'm curious, what can we do with data in your opinion, and what are the opportunities with healthcare data? Who owns it, and like, for example, we've heard this Apple EHR and you can carry that with you. I'm just curious from your vantage point, what is this opportunity, the data that everyone's talking about in reality?
Yeah. So in terms of who owns the data, I think ultimately each person should own their own data. And I think that will be further facilitated with the interoperability rules, where in essence, people are going to be able to grant access to their data to some, third party. And just as now we kind of, I think, mindlessly check the terms and conditions box every time we have, an iOS upgrade or whatever, I think ultimately that's what's going to be the case in the future.
So no more forms to fill out at the beginning of every office visit?
That's my hope. I mean, people get irritated by answering the same 17 questions 18 times over. So I think people will own their data moving forward, and the possibility is for data to serve as the fuel or the lifeblood, really, for the vision that we talked about earlier.
Mm-hmm.
I think the reality of it is tricky, though. Just think through the hundreds, thousands, millions of cells of data that are going to be getting collected,
mm-hmm.
right? And talk to a given physician. This is where my husband's a great focus group of one for me, where I concoct these ideas and he's like, no, let me tell you how it really is. And so, in some respects, clinicians and doctors are overworked and they're still in the sick care business. So they're like, I really only want to know the most pertinent information.
Mm-hmm.
Don't overwhelm me with gobs and gobs of stuff.
Right.
And I went to medical school. I don't need Dr. Google, although over time, that may shift a bit as Google and others are going to be able to augment with great precision and reduce the practice variation that plagues much of the industry now. But that notwithstanding, I think we're going to have to be really lasered in on what are the data points that matter for
mm-hmm.
physicians so they can actually act on them. Mm-hmm. What are the data points that matter for consumers or members so they can act on them? It's mm-hmm. just like we talk about data. Well, garbage in, garbage out. You have to make sure what you're getting in is good. And then you want actionable insights. What do I do with this? If I don't know what I do with it, it's just a lot of stuff that might make me feel slightly better that I have access to it, but I don't know what to do with it. So I think that's where we have more work to do.
Just to put a finer point on that question, is it that we have garbage data coming in and we need to refine that? Or is it kind of like the UI, even like the user interface design of the output that needs to be more helpful? Or are they equally have opportunities to improve?
It's a good question. I think the data quality varies depending on the organizations that you work with. In my case, in terms of what we see actually pretty high quality data.
Okay.
But the user interface needs a lot of help. Yes.
And that's where, to our earlier conversation, the whole idea of like big tech's expertise can come in, because they make things so easy and so simple and so routine that you're able to just triage digitally before you even require the doctor's brain to triage, right? I was reading earlier about this idea of condition-based EHRs and this idea of problem views, where you show the doctor simply, here are the conditions this person has and what they need. Then you as a doctor can say, well, okay, the diabetes thing we'll deal with later. This thing's acute. We got to deal with this now. And that alone, just that visual cue alone creates so much value, which is, I think, the power of technology. I think the ability to take such complex data and refine it into something that's very easily digestible is the power and is where the opportunity is. And I'm very intrigued by the fact that, or what I've learned from this conversation rather, is that I thought that the data was really the problem and the UI was the easy part that we could fix once we got the data. But it's interesting that we actually have the data and we just need to do the translation better.
I think that's right. And the other piece that I would add is one critical missing ingredient is good old-fashioned business process redesign. If we're just layering on data, even beautifully presented, on top of the existing processes, many of which are fairly fractured and fairly Byzantine and fairly siloed, it doesn't help that much. I love Jeff Margolis, who is the chairman of WellTalk, has said, telehealth does not equal digital health. And I think that's really a profound statement when you think about it, because in many respects, just taking existing resources and processes and having it over a screen, that's good. It helps in some ways. but it's not getting to the step change in efficiency that we need to get to,
Right.
where we're actually able to radically reduce costs and improve outcomes and experience. And so that's where you need to reconsider, what's the support model? What are the processes? Who's actually involved? At what point are they involved? Can I use up less of their time? How can the data actually help reinforce what's required and double check and triple check what's required, or present things that we wouldn't have seen otherwise, or unless, or we would have only anticipated if we had the world's best expert on it.
And on that, I'm curious, how do we kind of encourage health systems or clinics to kind of adopt new business processes, right? I think, like you mentioned, there's burnout. Every new tool feels like, just another tool to help, someone's pinky. And like, I'm not interested in that. And right, you mentioned also like the vector of value-based versus like pay per service. And like, how do you incentivize or like highlight that there's this, great new way to do things, and then, get them to act on it?
It's a great question. I think this is where we need to marry technology with human-centered design, thinking, and ways of working, and really falling in love with the problem and involving the end users. And the end users are oftentimes the frontline staff, the clinicians, and others, as opposed to, some small group of us sitting in front of a whiteboard divining what we think the future will hold. And so I think really getting hands-on and involving a small group who can then serve as ambassadors later is really a critical piece. So that's one major component. I think the other piece that I would say is that we need to start to outline what the data infrastructure and the analytic infrastructure needs to look like to create more of a platform view, where you're able to integrate all these various myriad point solutions. And you have an air traffic controller kind of engine that helps to navigate and determine what to turn on at what point for whom. And that's something that's somewhat of a gap in the industry right now. Many folks are talking about creating a platform. It's part of, many pitch decks that you'll see. But really almost identifying what the industry standard will be would really help the industry considerably, because otherwise, for any given clinic, in your case, Chris, as you asked about, or payer, the underlying legacy systems are so involved that even trying to do something that seems relatively simple, even when it's a so-called free pilot, it's not free, right? Because it costs a lot of money, it takes a lot of time, it takes a lot of effort to work with the legacy systems. It's not plug and play. And so that becomes one of the biggest rate limiting factors.
Sue, I feel like we could jump on this topic for a really long time. I know we're coming up on time, and usually we have a closing question, but we've been talking about bold futures for a while. So I wanted to take the last couple minutes and hopefully just give you a platform to talk about your wisdom, your thoughts on being a legend, being someone who is so respected in the boardroom, while also, winning the 2016 Working Mother of the Year award, and just give you a chance and a platform to share any advice you have through your experiences being that person.
Well, first, that's so kind and generous. So thank you for that. I guess a few thoughts that I would share are, I think it's really important for people to be authentic to who they are. And, people talk about imposter syndrome, especially for a lot of women lots of times. And I fully and wholly empathize with that. Although, to be honest, I don't have that. I view it as you do great work and you do your best and you let go of the rest. Full stop, period. That's it. And you do it in a way that's sincere. You're sincere with others. Hopefully they will reciprocate. Usually they do. And there will be times when you'll get shot down. That's okay. You sort of expect it at the get-go. And you let it go. And sometimes, especially when you're trying to drive change, not everybody's going to be on board. You almost have to expect that sometimes people are going to try to work against you. And if they're not, you're probably playing it a little too close to the vest and taking it a little too safe. And so you kind of almost have to go in with that perspective and that expectation. And then I think and then the third piece I would say is know what grounds you and motivates you. And for me, it's really my family life and my spirituality.
Hmm.
So that's paramount for me. And then everything else falls into place. So it sounds a lot easier to say than I think I recognize it can be to do. But I do believe sort of taking the long view, doing your best, having faith and confidence that if you give your best, you're going to do great. It may not be perfect. That's okay. Nobody's ever perfect. And if you're sincere, people will recognize that. And some people won't, and that's okay. You expect it. If they don't, you're playing it too safe. And then ultimately find a way to center yourself.
Oh, Sue, this is why you are a legend. I think our listeners finally got a glimpse, through this whole podcast of who Sukanya Soderland is. And if you don't know her, you should. Thank you, Sue. Thank you for joining us. Thank you for imparting your wisdom, both on healthcare and on life. We really appreciate your time.
So kind. Thank you. This was fun.